Welcome to Med Medicine with Miss P. This is probably going to be a short one because, as always, I have 100 things to do and I'm kind of freaking out about something. Anyway, couple little things here, and I haven't really gotten any good info in a while because I was on vacation and then I haven't been in that department for a while. But just some stuff that I made a few notes on, cute little things that patients say. Under their hypertension, there's a little box they can fill in or put some information in, and they always want to do that. You should just leave it empty. You have hypertension, check that box and move on. Because I usually delete what they write in because it makes no sense. And then the way it prints out, it looks like more to read than you have to. And then when you're done reading, those are minutes you can't get back from your life. So this one I thought was precious. They checked the hypertension and then they wrote in there that hypertension is resolved with meds. Like an antibiotic, it's all done now. They took a little treatment of metoprolol and now they don't have hypertension anymore. It's all cleared up. Now, if you take medication for hypertension and you take it every day and probably will the rest of your life, you have hypertension. It's controlled with meds. It doesn't resolve with meds. It's not if you keep taking the meds. If you're on an antibiotic the rest of your life, then you have a chronic infection, I guess. I did notice this one patient was on like 3 different Alzheimer's meds, and then they left the box empty. They probably forgot to check it. That was cruel. And also, I listened to a YouTuber that talks about this from time to time. Many YouTubers, many people in general. There is no T in Alzheimer's. Y'all know that, right? There's no T. There's not a T in there. Nowhere in there does the man have a T in his name. Alzheimer's. There's a Z and an H, but there's no T. You can take that T out of Alzheimer's and put it back into mastectomy where it belongs because you didn't have a mastectomy. You had a mastectomy, not a mass. There wasn't a mass removed. Like there's a lot of tissue removed. It's a mastectomy, right? The mastectomy, not a mass removed. One patient told me that he has hereditary hearing loss, but no hearing aids yet. It's hereditary. So he was born with it, but it'll show up later, hereditarily, later in life. This one patient had emphysema as a child. Did you grow out of your emphysema? Did you heal? You cured your emphysema? Do you mean asthma? One patient wrote in as an allergy, they get pneumonia. It's an allergic response is pneumonia. And they also have allergic pneumonia. When your allergies act up and you get pneumonia? I guess that's possible. Probably not though. This other patient, he's got coronary artery disease because of the diabetes. You know how that causes, no, that's not how that works either, but all right. I did have a patient. Did I mention this last time? It was so long ago, I don't remember. I had a patient, I checked her blood sugar and I said, it's 232. Is that normal for you? Is that okay? She's like, yeah, but I haven't had anything to eat. So, it'll get better once I eat. How much higher do you want 232? You want it to be better by going higher? Because if you eat, it's not gonna lower your blood sugar. And she said that to my face, that her blood sugar will get better after she eats. That's not how blood sugar works at all. Not even a little bit. And then I think my coworker found this, and oh God, it was precious. The patient charted that she was allergic to it, but she can take it in IV form. Like orally, she, has an allergy to it, but if she takes it IV, it's fine. If we go directly into the vessel with this medication she's allergic to, it's fine. But if she swallows it, it's not fine. All right. Yeah, and another person charted in there if they needed an interpreter. She wrote yes, and then it said, what language do you speak? And it said English. I feel like I feel like I speak English fairly well. I mean, I would like to think so. This other patient takes levothyroxine. Do you think that means if you have a thyroid problem with joint pain, you think there's a medication out there that's levothyroxine and chondroitin combined? Levothyroxine? I don't think so. Yes, under other illnesses, and I know I'm sure he thinks this is funny, but there's got to be a little tiny part of y'all out there that realizes when someone does it for a living over and over and over, and that is their daily, like 40 hours a week, they're dealing with this over and over and over. It's really important you stop trying to be funny. Like my husband was a courier for FedEx and now he's with UPS. And if I've heard it once, I've heard it 1,000 times that if FedEx and UPS merge, it'll be called Fed Up. Yeah, that was hilarious in 1993, which was maybe the first time I heard it. It's not funny 30 years later into your career. I don't stop saying that. I know you think you're original. You're not. So under other illnesses, this patient wrote in that he was brain dead. While that may be true, we don't this you're having surgery. This is not really the time to joke, and it's fine to have a sense of humor and stuff, and we enjoy that, and that's great, but probably not on a medical document here where we're trying to get information to take good care of you. Another patient said that they have to self-cath due to pneumonia. I don't know that I ever got to the bottom of that. Because they have pneumonia, they have to self-cath. I don't know that I even touched on that. I may have jumped that shark altogether, not remotely interested in what that was going to say. Another patient, they don't want to put their medications in to their medical form you fill out online because there's too many. It's just too many. I'll just bring them to you when I get there. Right. We should probably find out 10 or 15 minutes before surgery that you have all of these disease processes that you take medication for, because most of the time they won't write in what disease process they have because they think that if they're on medication for it, it's cured. So then you see this long list of medications and then you recognize that they have, a long list of disease processes. So this person didn't put in any meds, and of course they have AFib and they're on metoprolol and a bunch of others, but didn't even mention that the whole AFib thing, you have to pull it out of them. Kind of something we should know before surgery. I'm just guessing. And there's also that box I told you about before where you could say, like, it says, what can we do here to make your visit better? How can we take, better care of you? And someone put in there, don't make mistakes. Okay. All right, we'll try harder this particular time with only you to not make mistakes, because otherwise we're so careless that we often make mistakes. We don't try to kill anybody or make mistakes or not keep you comfortable. Keep me comfortable. That's literally our main goal. That's the whole point of anesthesia, is we're going to keep you comfortable during the procedure. So can y'all not write those things in there? It's so painfully stupid. And I don't even think you realize how dumb it is and how senseless it is. And it's truly annoying. Put something in there that really matters. Like if you have a frozen shoulder, you just had a hip replacement, or something that we need to know to care for you best. Otherwise, just leave it blank. Another patient, I guess they said that they had cancer. So under surgery, they put uterus removal, which is fine. Maybe not everybody knows that's called a hysterectomy, but the old removal of the uterus is a good response to, if it's filled with cancer, uterus removal. Oh yeah, I talked to another patient. I said, who's driving you home? And he goes, not sure yet. I'm like, well, we kind of need to know who that is. I said, do you know who's driving you home or their phone number? He goes, no, I don't know who is driving me home yet, but here's a phone number. So they gave me a phone number of somebody that they don't know that is driving them home, I guess, or they don't know who is driving them home, but they have a phone number of maybe they have a prepaid phone that they're going to give this phone to the person that's driving them home. I don't know, but you can't Uber home. One more person tells me that they're going to call an Uber or taxi. You can't, not after anesthesia. We're not just going to send you home and hope you're okay by yourself. That's not the way that works at all. Oh, and you know what? I've never heard this one. I don't think I've heard this. But this man, and he was a little bit of a jerk, and then he kind of softened up a little bit. They're always like so weirdly defensive, and I'm like, just answer the questions. It doesn't make any sense. Under surgeries, he said he had a sports hernia. You know the hernia you get when you play sports ball? A sports hernia? I don't know what a sports hernia is at all. I said, do you mean an inguinal hernia repair? Like, was it in your groin? And he's like, well, yeah, it was a sports hernia. I'm like, you can keep saying sports hernia, but there's no such thing as a sports hernia. I'm assuming he means an inguinal hernia. And then I had to try to find out which side it was, and turns out it like ruptured or something. So I was like, okay, you need to give me the lowdown here. But he just kept saying sports hernia over and over and over. I'm assuming it's an inguinal hernia. Have you ever heard of sports hernia? Me either. Maybe you have. Oh, and then I asked this patient, I had to giggle to my coworker. I said, do you have anything removable in your mouth? Do you wear glasses? They're like, yes, just for distance and reading. So bifocals, so you have bifocals. So yes, you have glasses. Just say yes, you wear glasses for distance and reading, in case you're wondering. Oh, all right. And then I asked if someone had, you always have to say like, do you have an inhaler? They're like, yeah, I just have a regular inhaler. I'm like, what's a regular inhaler? And she couldn't tell me what her rescue inhaler was versus her regular inhaler, and she just kept saying regular inhaler. I'm like, can you just read me the name of the medication off the inhaler? And she's like, yeah, it's just one of the regular ones. Albuterol, ProAir, Spiriva, nothing. I'm just going to keep naming stuff. And then also, I think that it was the same lady that said, we always said, have you ever had any trauma to your back, neck, or nose? You ever had, like a traumatic injury? And she's like, well, yeah, I was intubated. Well, what was the trauma? Well, I had surgery. Right, but what was the trauma that you had requiring surgery? She's like, oh no, whatever surgery she had, it was, like a gallbladder or something. She goes, but I had to be intubated. Yeah, everybody having general anesthesia is most likely intubated or has an LMA, but have you ever had an injury, a traumatic injury to your back, neck, or nose? This is a yes or no answer. And they always go on these bizarre tangents that have nothing to do with the question. And as soon as I get someone on the phone and they're like, yes, no, yes, no, yes, no, it makes it so much easier and so much more enjoyable to get their information, tell them, all the instructions they need to know, and then move on, because I don't know how they correlate things. Like that time, I think I told you when I said, do you take any other, or I think I said something like, do you have any other metal on your body, anything you can remove, rings, watches, bracelets, piercings, anything like that? And he was like, well, I've got some tattoos. I'm like, okay, can you remove them before you come in for surgery? Are they metal? Do you have metal tattoos? What a weird thing to say. Like, can you hear yourself? Like if you're at a deli and someone says, what can I get you? And you're like, I'd like a bag of chips. They'd be like, okay, they're on aisle 3. You're staying at the deli. Do you have any deli meats you would like? Any cheeses, anything? And then you just ask for something that's completely off the wall. Like, yeah, I need a magic sponge. Okay, then it's down the other aisle. Just answer the question. Maybe it's the way we ask. Maybe it's the way it's written. I don't know. It's very odd. And then, under alcohol, they wrote very occasionally. It's daily, rarely, or occasionally. There's no such thing as very occasionally. That's not, I don't even know how one would, I don't know what that means. I haven't figured that out, but all right. Uh, Oh, and then another patient, you can, they have a choice. And I really don't know why this is a choice. It really shouldn't be. It should be just ignored or not in there at all, because no patient understands this. And I don't even necessarily think that they should. But this patient thinks that they had a appendectomy under an epidural. Like which I guess it's maybe possible. I mean, I don't think so, but I don't know why they even give them that option. They don't know the difference between epidural, spinal block, general anesthesia, sedation. They have no idea what any of that means. I'm not sure why it's there. Maybe it's like an IQ tester, but it really shouldn't even bother being in there. Oh, and then the last one I've got here, which is putting us right at the perfect timing. This patient asked if she was going to have an epidural for her cataract surgery. I'm not kidding. Ask, am I going to have an epidural for my cataract surgery? She must have misunderstood something. I think she filled out the wrong form. Like, there's an option, we do pain cases and then we do surgery cases. And I think one of these forms that she filled out was for a pain case, and it asked about like where her pain was and what kind of injection she was getting or something like that. There must have been some confusion, but she asked me if she was getting an epidural for her cataract surgery. I'm not sure how to even approach that. So no, an epidural would be in your low to mid back, and it would not numb your eyes. And if you had an epidural that could go up to your eyes, it would obviously numb or paralyze your diaphragm. Now, I didn't tell her any of this. I just simply said, no, honey, you're not having an epidural for your cataract surgery. But for any of you out there that don't know, anything that is in your spine can travel up and travel down depending on which level it's in. And that's why, you're not going to be paralyzed from the waist down for an epidural, when you're pregnant or anything like that. Which means, we obviously can't numb your eyes through your spinal cord. I'd like to think you already knew that, though. Okay, well, that's it. I got to get out of here. Face your fears, forget your failures, follow your faith, and I'll see you next time.